Welcome. My name is Brian Fairman. I am a postdoc fellow in the Department of Mental Health at Johns Hopkins Bloomberg School of Public Health in Baltimore, Maryland. I want to say that if you like this presentation and you are interested in some of my other research, you can find more information available on my website at brianjfairman.com. So I think one of the biggest changes in drug policy over the past 20 years has been the enactment of state medical marijuana laws. So currently 24 states and DC allow for medical marijuana, with Pennsylvania just joining this year in 2016. And of course, there are 4 states and DC that also allow for the legal possession of non-medical or recreational marijuana use. And there are at least 14 states that currently have a ballot or legislative measure to legalize marijuana for either medical or non-medical use. So we're clearly moving towards greater legal access to marijuana for patients. So how many people actually are using medical marijuana in the United States? Well, according to the Marijuana Policy Project, there are about 1.5 million people who use medical marijuana. Now, this number is based on data from state-run medical marijuana registries of patients, and they make assumptions about the rates in California and Washington, which either have voluntary registries or don't have a registry at all. And so, but they also are able not to consider medical marijuana use in states that do not have medical marijuana laws. So I separately estimated a number based upon the nationally representative data from the National Survey on Drug Use and Health, which brings this number much higher to 2.7 million. And this could be because about 1/3 of the people who said that they had used medical marijuana in the past year didn't actually live in a medical marijuana state at the time. But what I'm going to be talking about today is how medical marijuana use has changed over time, and why is this important? Well, one, we can start to consider how policies might be affecting trends in medical marijuana use and access to use. Two, these estimates can give us an idea of the current and potential future demand for medical marijuana. And then 3, we might be interested in looking at potential relationships between these trends in medical marijuana use and other important outcomes of interest, such as adolescent marijuana use. So I'll also be presenting some data to show differences in trends in medical marijuana use by gender, and then also by age. So all the data I'm going to show you come from mandatory medical marijuana registries. Now, what this means is that in these 13 states and DC, you have to register as a medical marijuana patient in order to legally possess medical marijuana. Now, there are exceptions. So, like I said, in California and Maine, registration is explicitly voluntary, while in Washington, they don't currently have a patient registry. So you won't be seeing data from these states at this time. And then 7 other of the medical marijuana states only recently passed medical marijuana laws. And so there really isn't either any trend data to look at, or in some of these cases, states haven't actually started registering any patients. Now, all these data are in aggregate in number, so I didn't really have any access to any individual level data. So what I did is I took the number of medical marijuana users reported in each state at each time point, and I divided by the size of the state's adult population based on U.S. Census. And so what that does is it just kind of adjusts for the fact that states have different sized adult populations. And then I took that ratio and I multiplied it by 1,000 in order to come up with an estimate of the number of medical marijuana users for every 1,000 adults. And I plotted these estimates over time. So let's first look at these trends. So again, you have time on the x-axis, and on the y-axis is the number of medical marijuana users for every 1,000 adults. And you'll notice that before 2009, you have relatively low levels of medical marijuana participation in the states with the data. So what might be going on at this time that might help us explain this trend? Well, prior to 2009, there was a much more stronger federal government prosecution of medical marijuana businesses. And this is kind of highlighted by the fact that in 2005, the Supreme Court kind of upheld the right of the federal government to criminalize people who were engaging in the medical marijuana industry, even in states where it was legal by state law. But then you can see, beginning in 2009, there's a quite increase in participation, especially in Montana and in Colorado. And so what was going on here? Well, by early 2009, the Justice Department signaled a change in policy, where they essentially said that they were no longer going to make prosecution of people compliant with state medical marijuana laws a top priority for them. And then if you read news reports throughout 2009, what you see is in states like Colorado, Montana, Michigan, California, where dispensaries were not explicitly prohibited, you see reports of a spike in the number of dispensaries opening up. One of the ways that they would try to compare this to is that they'd say that there were more medical marijuana dispensaries than Starbucks in whatever city they were talking about, whether it was LA or Denver. So all I've done in this slide is it's the same figure. Just I've just zoomed in on the time between 2009 and 2015. And what you'll notice is that around mid-2011, there's a peak in participation, and particularly in Montana and Colorado. And a little bit later, there's a peak in Michigan, because Michigan didn't pass its medical marijuana law until late 2009, so it got a little bit of a later start. But if you look at what's happening in the state of Montana, in May 2011, right at the peak, they passed legislation to remove the profit motive of dispensaries. And then they also required chronic pain patients to have more documentation of their etiology. So they had to have kind of more proof that they had an underlying condition that would cause their chronic pain. And you'll notice that after that was passed, there was a significant drop in participation in Montana. So then in June 2011, Colorado passed its own legislation that required medical marijuana dispensaries to be licensed. Before that time, it was kind of more of a wild west of dispensaries popping up. And so in order to kind of halt that expansion, they required licensure, and they put a moratorium on issuing new licenses. But then they also required physicians to have more of a bona fide relationship with their patients. And you'll notice that even though participation did drop off in the short term, it did kind of rebound a little bit later. But then if we look at the federal level, some things are still also going on. So in June of 2011, the Justice Department issues another memo that kind of clarifies that, yes, the federal government can still come after and raid marijuana businesses and dispensaries that they suspect of violating federal law. And you do see some increased raids in some of these states. So now let's move a little bit farther ahead in time. And of course, in November 2012, Colorado passes its recreational marijuana law. And you'll notice that after that, you don't really see a big change in the size of the medical marijuana population. And then in Michigan, in February 2013, the state Supreme Court declared dispensaries illegal, but many dispensaries still remained open. They weren't forced out of business. Nevertheless, you can see that throughout 2012 and 13, you have a plateau and more recently, perhaps a little bit of a decline in medical marijuana participation in the state. And then throughout 2013, in some of these other states and DC, you start seeing them opening up their first medical marijuana dispensaries. If you look at Rhode Island, after 2013, there was certainly a faster rate of growth in medical marijuana participation, but not quite as dramatic as we saw earlier with Colorado and Montana. And some of this could be the fact, like in states like Vermont, they're really restricting the number of dispensaries that can open up in a particular state or in a particular county or sometimes congressional district. So these states have kind of started to learn from the example in Colorado. And of course, finally, in January 2014, retail recreational dispensaries opened in Colorado. And again, you're not really seeing much change in medical marijuana participation, although taxes for recreational marijuana is much higher than medical marijuana. And medical marijuana users can possess a larger amount of marijuana than recreational users. And of course, 18 to 21-year-olds or anyone under 21 really can't take advantage of the retail market. So there are still reasons, I think, for people to remain in the medical marijuana program. So let's move on and talk about differences by gender. So the y-axis here on the left shows the proportion of medical marijuana users that are male, and it starts at 55%. So that tells you that in all the states that I have data from, there are more males in these medical marijuana programs than females. But if you look at Arizona and Colorado, which has the more long-term trends, you can see a pretty consistent decline in the proportion of male medical marijuana users. And this is during a period of their time when overall participation is actually increasing. So this is unlikely due to males just dropping out of the program faster. It's more likely that women are signing up at faster rates. You can see also a decline in Rhode Island, even though I don't have able to show 2 years of data there. And then you also notice that in Oregon and Alaska, I only have one more recent data point, but they had the lowest proportion of male medical marijuana users, but they also have had medical marijuana the longest of these states. So then, by contrast, DC had more recently passed its medical marijuana law, and it is the only state where I saw that the proportion of male users were actually going up. So what this might mean is that males are more likely to sign up for medical marijuana programs initially, but that women might be catching up over time of the program. So what are some differences by age? So this shows the trends in medical marijuana use among people who are under the age of 18, so minors. And because there are so few minor medical marijuana users, I've had to rescale the y-axis so that it's now the number of minor medical marijuana users per every 100,000 minors. And I think what's interesting about this figure is if you look at the period of around 2010 to 2012, you can see Montana has a relatively sizable number of minor medical marijuana users that completely drops off kind of beginning in 2012. And this is probably likely related to the passage of the change in the law in Montana. But then you can see that about a year or so later in Colorado, there is a sharp increase in participation in this age group that was preceded by a very low and kind of flat trend. And it's not entirely certain what's going on here, what may be why this trend is happening. However, if you read some of the news reports around this time period, they profile parents who have children who are using medical marijuana who are moving to Colorado in order to take advantage of their more developed medical marijuana market. So some of this could be an influx of parents coming to the state. And then there are also relatively higher rates in Oregon, but I only had 2 time points. It looks like it might be going up, but I can't be certain based upon this data. So what are some differences in medical marijuana use by age? And I'm only showing 4 states here that had the highest per capita medical marijuana participation. And this is all based on kind of more recent estimates. And so what you have along the x-axis of these of each of these figures is percentage, and within the state, the percentages should add up to 100%. Now, I want to contrast for you the states on the left, Arizona and Colorado, with the states on the right, Montana and Oregon. So what you'll notice on the left is that in Arizona and Colorado, there's a larger proportion of medical marijuana users are in their 20s and 30s. But if you look over in Montana and Oregon, you can see a much higher proportion of medical marijuana users are actually in their 50s and 60s. And I mean, this is interesting for, I think, a number of reasons. In Montana and Oregon, the people who are in their 50s and 60s are, tend to be from the baby boomer generation, who were using marijuana in their early adulthood during the peak of marijuana use during the mid 1970s. So maybe these adults, now that they are older and they're maybe coming down with some of the qualifying medical conditions like cancer and glaucoma, that tend to be age related, maybe they're just more open to using medical marijuana. And I'm not showing Alaska, Nevada, Rhode Island, and Vermont, but their trends tend to mirror Montana and Oregon rather than Arizona and Colorado. So I am going to show you trends over time by age in one state, in Montana, because I think they're really interesting because they capture the peak increase during the time in that state. And what you'll really notice is that before the legislative change in 2011, the age group that rose the fastest in participation were the 21 and 30-year-olds. And so after it peaked, when they passed the legislation, they're the age group that fell the furthest of any of the other groups, such that by 2015, their level of participation is much lower than some of the other groups, like the 30 to 40-year-old groups, who also peaked fairly high, but have kind of remained relatively high up in the distribution. So, so the takeaway message from this slide is that medical marijuana laws can affect patients differently by the age that they are. So there are a number of limitations to the data. I'm just going to highlight probably the most important ones. And one is that these numbers could be underestimated if there are a lot of medical marijuana patients that do not register. Even though it's mandatory to register in order to possess marijuana, if you are growing it your own and you're not interested in being in a government database, you might still use medical marijuana but not register for the program. But these numbers could also be overestimated to the degree that there might be recreational users who are just registering in order to get into the program and be able to possess marijuana. I mean, that's something somewhat counterbalanced by the evidence in Colorado, where we didn't really see a big change in medical marijuana participation after they legalized it. But like I said, there could be a lot of reasons why recreational users might still want to take advantage of the medicinal market. So, I mean, these data aren't perfect, but I think they're really interesting to look at, particularly because I can't really find much better data on this subject as far as state level or representative estimates of medical marijuana use. As more surveys, national surveys like the U.S. National Survey on Drug Use and Health start um, asking people about medical marijuana use, we might be able to compare the registry data to samples, epidemiological samples, to see how representative is this data of all medical marijuana users. So to summarize the main findings, so trends in medical marijuana use is varying by state and within state over time. And I think these trends are likely heavily influenced by federal and state policies and their interaction. So it's not just the federal policy, it's not just state policy, but what federal policy means to state policies in that particular state, because there's a lot of differences in, again, in how the laws are enacted. I think dispensaries could be a key factor in this. Like I showed, participation really rose in the states that had kind of this open market that allowed medical marijuana dispensaries to flourish. And as I said, by gender, males seem to be early adopters into these medical marijuana programs, but women appear to be catching up over time. There are very few medical marijuana users that are minors or under the age of 18, but this seems to be increasing segment, particularly in Colorado and perhaps Oregon. And then we should be mindful that the age distribution of people who are using medical marijuana might differ significantly by state, particularly in Alaska, Montana, Nevada, Rhode Island, and Vermont. Medical marijuana users tend to be older, whereas in Colorado and Arizona, they tend to be younger. And certainly, as we've seen in Montana, these policies do seem to affect medical marijuana patients differently by how old they are. So this will be the end of my presentation, but I have a few other slides I just want to briefly talk about before finishing. Now, I said earlier that I wasn't going to show any data from California, mainly because, again, they have the big caveat is it's a voluntary program. So no one really believes that these numbers are an accurate reflection of the actual number of people who are using medical marijuana in California. But if we just look at the trend of people who are registering for medical marijuana over time, you can see something that's quite interesting is that there is quite a peak in registration around 2009 and 2010 that very much mirrors what was happening at the time in states like Montana and Colorado. And then, of course, after that period, you see a decline, and then kind of more recently, it's more of a flat numbers. But again, it's kind of tenuous of how much this data reflects trends in overall medical marijuana use in California. And then this slide just highlights something else I'm trying to do with the data in the future. I have data on the number of medical marijuana users by their qualifying medical condition. And so what I would like to be able to do is, if I have a good estimate of the number of people with a particular condition in each state at each time point, for instance, the number of people with HIV/AIDS, what I can then do is take the number of medical marijuana users who are HIV/AIDS patients, divide by the number of prevalent cases of HIV/AIDS in the state, and you can get kind of a rough, I think, estimated prevalence of medical marijuana users in medical marijuana use in people with HIV/AIDS, which I think is I don't think anyone knows about. And so if we look briefly at these trends, you can see that there's quite a variation between states. So in Oregon, you have 147 medical marijuana users with HIV/AIDS for every 1,000 HIV/AIDS cases, or around almost 15%. And then you can see some of these trends in some of these states have gone up, but then they kind of plateau. Particularly in Colorado, it seems to have been flat over the last several years. Although I do have to point out that in 2013, 14, and 15, I didn't have really any good data at the time about prevalence of HIV/AIDS in those states at those times. So those estimates are really based upon numbers from 2012, assuming that there really isn't much of a change in the increase or decrease in the number of HIV/AIDS cases in those years. So again, I want to thank you for listening to my presentation, and you know, please like the video if it was helpful. Thank you.